Caffeine is a stimulant that is frequently ingested and can be found in a variety of beverages and meals. Being able to improve one's mood, as well as one's capacity to concentrate and focus, is one of the reasons why it is such a popular choice. Nevertheless, prolonged consumption can result in agitation and sleeplessness. An increase in talkativeness and restlessness may be experienced by users, although moderate usage often provides little risk. On the other hand, excessive consumption might lead to an elevated heart rate as well as stomach symptoms. Alcohol. Alcohol first produces feelings of relaxation and exhilaration since it is a central nervous system depressant. On the other hand, it can impair judgment and coordination, which might result in uncontrolled conduct and changeable moods. It is essential to practice moderation because prolonged overuse can lead to addiction, damage to the liver, and an increased risk of accidents. Nicotine is a stimulant that is included in tobacco products and is extremely addictive. Although it provides momentary pleasure and alertness, nicotine is associated with severe health hazards and has the potential to lead to addiction. In addition to increasing the risk of developing lung cancer and heart disease, smokers frequently engage in rituals and are prone to irritation. Heroin is an opioid medication that makes users feel euphoric and relieves pain, but it also poses significant health concerns, including the possibility of overdose and addiction. The use of substances is linked to respiratory depression and infectious infections, and addicts may engage in dangerous behaviors and exhibit secretive behavior because of their addiction. Meth. Methamphetamine is a powerful stimulant that is well known for its ability to induce feelings of pleasure and energy. Addiction, insanity, and a decline in physical health are all consequences of its use. Hyperactivity and paranoia are two symptoms that may be exhibited by users, and extended usage may lead to cardiovascular and dental complications. Phencyclidine, also known as PCP, is a dissociative hallucinogen that causes detachment and hallucinations. It additionally frequently results in erratic behavior and paranoia. There is a correlation between long-term usage and psychosis and seizures, and users may exhibit symptoms such as depression and violence. Steroids. Although synthetic substances such as steroids are known to promote muscle growth, using them carries hazards that include aggressiveness and liver damage. Additionally, extended use can lead to cardiovascular difficulties as well as behavioral illnesses. Users may also demonstrate aggressive behavior. Nitrous oxide, is an inhalant that makes you feel happy and dissociative, and it often makes you laugh and lose your temper. As a result of prolonged use, nerve damage and cognitive impairment can develop, in addition to the dangers of accidents and injuries that are linked with it. Shrooms, psilocybin. Psilocybin mushrooms can cause spiritual experiences and deformed vision, which could lead to self-reflection and mood swings. A hallucinogen persistent perception problem may develop as a consequence of prolonged use. LSD, or lysergic acid diethylamide, is a strong hallucinogen that changes awareness and perception. People who use it often become interested in their surroundings and experience mood swings. A hallucinogen persistent perceptual problem may develop as a result of prolonged use. MDMA, also known as ecstasy, is a strong empathogen that causes users to experience feelings of euphoria and emotional openness. As a result, users demonstrate increased sociability and empathy. Cognitive impairments and emotional problems are two potential outcomes of long-term use. Lean is a mix of codeine and promethazine. It helps you relax, but long-term use can make you tired and affect your judgment, which can lead to addiction and breathing problems. DMT, dimethyltryptamine, is a highly potent hallucinogenic substance that induces profound auditory and visual hallucinations, frequently accompanied by the revelation of spiritual truths and the discharge of emotions. Individuals who are vulnerable to it may have anxiety and panic attacks, even though it is quite safe. Cocaine is a powerful stimulant that causes users to experience pleasure and enhanced energy. Users of cocaine also demonstrate hyperactivity, impulsivity, and talkativeness of their behavior. Addiction, cardiovascular issues, and psychological illnesses are all potential outcomes brought on by prolonged use. Ketamine. Ketamine is a dissociative anesthetic that makes people lose touch with reality and have hallucinations. People who use it feel disoriented, confused, and unable to coordinate their movements. Utilization consistently can lead to addiction, cognitive impairment, and harm to the bladder. MDA 3,4-methylenedioxyamphetamine. MDA is a man-made drug and empathogen that makes people feel euphoric and empathic. It also makes people more social, emotionally open, and physically energetic. A neurocognitive impairment and mental disorders may develop as a consequence of chronic usage. Salvia, scientifically known as Salvia divinorum, is a psychoactive botanical species that has the potential to induce profound hallucinations and modify perception, which may manifest in users as uncontrolled laughter, confusion, and disorientation. Anxiety, panic attacks, and psychosis are sometimes connected with it. Kratom. This drug comes from the leaf of a tropical tree and has effects that are similar to opioids and stimulants. It makes people feel good, calms them down, and lessens their pain perception. An addiction, dependence, and withdrawal symptoms may develop as a result of prolonged use. Gamma-Hydroxybutyrate, GHB. GHB slows down the central nervous system and makes people feel relaxed and sleepy. This can make them lose their memory, make bad decisions, and become confused. Prolonged use can result in addiction, depression of the respiratory system, and impairment of cognitive function. DXM, dextromethorphan. DXM is a cough medication that causes dissociation and hallucinations. Users frequently experience confusion, disorientation, and difficulties with their motor skills. Utilization on a consistent basis can result in addiction, psychosis, and serotonin syndrome. NBOME, or N-benzylphenethylamine, is a man-made hallucinogen that changes your vision and causes visual hallucinations. It can also make you paranoid, agitated, or psychotic. Seizures, cardiovascular issues, and overdose are all related with substance abuse. Spice. Spice is made up of synthetic drugs that have effects similar to marijuana, such as happiness, hallucinations, and relaxation. Addiction, insanity, and cardiovascular disorders are all said to be related with it. Crocodile. Crocodile is a homemade painkiller that makes people feel good and hurts their tissues badly. It often causes psychosis and strange behaviors in people who use it. Addiction, infection, and amputation of limbs are all related with it. Bath salts, also known as synthetic cathinones, are a type of synthetic stimulant that not only provide greater energy, but also hallucinations. They frequently lead to hyperactivity, paranoia, and aggressive behavior. Addiction, psychosis, and cardiovascular difficulties are all issues that are linked to them. Ayahuasca. Ayahuasca is a psychoactive drink that can cause spiritual experiences and dreams. Customers often feel introspective, let go of emotions, and have mood swings. The risk of anxiety and panic episodes is low, but it is believed to be relatively safe. Hallucinations are produced by the naturally occurring psychedelic substance known as LSA, lysergic acid amide. Users of LSA frequently demonstrate a curiosity with hallucinations and a vulnerability to their emotions. Nausea, vomiting, and constriction of the blood vessels are linked to it. Fentanyl is a synthetic opioid painkiller that relieves pain and makes people feel good, but it can also make them tired, drowsy, and slow their breathing. Substance abuse, overdose, and even death are all linked to it. Datura is a poisonous hallucinogen that causes delirium and confusion. People who use it often have dreams, memory loss, and strange behavior. Overdose, poisoning, and anticholinergic toxicity are risks that are connected with it. Poppers, also known as amyl nitrite, are volatile chemicals that cause euphoria and increase sexual desire. they can also make you lose your inhibitions, make you lose your balance, and affect your judgment. You may experience headaches, nausea, and cognitive impairment as a result of them. Xanax, alprazolam. Xanax is a prescription benzodiazepine that makes people sleepy and calms them down. However, it can make people have trouble coordinating their movements and remembering things. Addiction, overdose, and withdrawal symptoms are all connected with it being present.